Welcome to week 6 of HOS 121, and this week we are talking about psychosocial development in prenatal and infancy periods. And this is the second unit of our subject, so we will start to apply a lot of the concepts and theories that we looked at in weeks 1 through 5, including attachment theory, Erikson's psychosocial stages of development, nature and nurture. Those kinds of concepts will start to come out in terms of how they interact with the different periods of the lifespan. This lecture looks at the prenatal environment prior to birth, and then the perinatal environment, which is the environment around the time of birth. The prenatal environment, pre meaning before and natal meaning birth, is the physical environment of the womb, and the prenatal experience is critical to human development. There's really no other time in the lifespan when development occurs more rapidly, and also when the environment is potentially as important as the prenatal period. As we'll see from conception to birth, the experience of the womb has enormous impacts on human development. So why does nature set up prenatal development to be so sensitive to the expectant mother's experiences and environment? Well, really, the prenatal experience is preparing the child for life outside the womb. So every child, is unique and different at birth, and they've been shaped in the womb by their own unique experiences and environments during pregnancy so that they're better able to adjust to the specific setting into which they're born. So children begin to have sensory inputs already from their environments. They hear, as we'll hear about in the second lecture, during the fetal period, they can start to hear the mother's voice and her partner's voice. They start to experience taste, and they'll be impacted if something happens in terms of if the mother is malnourished. The baby's developing baby's body will start to adjust with expectations about the environment into which that child will live. The mother's characteristics and social context influence prenatal development in the prenatal environment of the womb. So, for example, characteristics like age influences prenatal development. It's more difficult for women to conceive as they get older, and there are higher rates of genetic abnormalities with older mothers. And an older mother is considered to be above 35. So once you're 35, you are called, in medical terms, an elderly prima gravia, which is an elderly mother, actually. So keep that in mind, right? And then there's also, on the other end of the spectrum, with teen mothers, there also can be problems. And so often it's linked to having less prenatal care and also higher rates of poverty with teen mothers. So age is one influence. Nutrition is another. So poor nutrition can lead to miscarriage and physical birth defects. Women often take prenatal vitamins like folic acid to make sure that they're getting the kinds of nutrients they need. Folic acid is linked to a lack of that in the diet is linked to spinal cord defects. And malnourishment can be particularly detrimental to physical and brain development. So if there's a famine situation, for example, the mother and the baby are really fighting over nutrients, and that can compromise the development of the baby. And then the mother's emotional well-being, her mental health, is also important. So prolonged and severe emotional stress can lead to miscarriage, can lead to more difficult labors. And there's also been research that has shown that there are signs of emotional stress from the mother during pregnancy that show up in the behavior of newborns, with some studies finding higher rates of digestive problems and irritability and irregularities with sleep and feeding when there's been a highly stressed mother. And then beyond that, the social context in which the mother lives is also critically important. So the baby's brain is really literally being constructed by the raw materials the mother's body supplies. So that has to do with her physical environment, from what the mother eats and drinks and breathes and absorbs through her skin. And it also includes the hormones and the chemical signals that her body makes in response to stress and in response to her interactions with other people and her environment. So, this process can influence the baby. There's something called epigenetics, which is the process where environmental signals alter the role of genes in guiding development. It's a really interesting and emerging science. We don't fully understand how the mother's environment influences prenatal development, but it's a really robust area right now for research, and it's clear that there are critical things that are happening in terms of gene expression during prenatal development. So linked to our class in week 2, where we talked about risk factors and protective factors, with risk factors being conditions that increase the likelihood of experiencing a negative outcome, and protective factors being factors that decrease the likelihood of experiencing a negative outcome. There are certain risk factors in terms of the outcome of poor prenatal development. And so those include things like the mother's health. So mother having certain conditions like having diabetes or high blood pressure, obesity, and having disease like HIV or other sexually transmitted diseases can have an impact on the developing baby. We'll talk about alcohol and substance abuse in the second lecture. These are known, what are called teratogens. These are known to cause problems, and have negative impacts on the development of a growing baby. Depression, anxiety, and other mental health issues is something we're going to look at this week in tutorial. So depression, it's well known that there's the baby blues after babies are born, but even during pregnancy can be a period when people have a elevated risk for depression and anxiety, and that can present problems in terms of the stress hormones and chemicals for the fetus. And then there are experiences like domestic violence, which again elevate the risk in terms of physical harm to the mother and the growing baby, and also the stress chemicals that would be affecting the developing baby. And social isolation is one of those things too, where that can have an impact on mental health. If a pregnant mother, doesn't have contact with friends and family who could support her through the challenges of pregnancy, there can be impacts on mental health. And then environmental toxins in the home, the workplace, or in the neighborhood are another risk factor. So we'll talk about environmental toxins in the second lecture, again, the ones that are known teratogens. But there are certain toxins, for example, if somebody works in an industry like doing nails, doing pedicures and manicures, that can present a risk to the growing fetus because there's a known potential there for harm in terms of being exposed to certain chemicals. So again, risk factors, as we talked about in week 2, risk factors are an opportunity for prevention. So for social workers and others who work with people like pregnant women, these are opportunities to think, these are risks that present some potential for harm for the developing baby. And so during pregnancy can be a time to do prevention around a substance abuse, for example, or really get involved in terms of domestic violence. It's known that can actually be an elevated risk of domestic violence during pregnancy, where sometimes pregnancy is a trigger actually for domestic violence. It changes the dynamic of the relationship. So these are opportunities for prevention as well, as presenting risks. And again, related to prevention, the other thing to do is to try to build protective factors that are present in someone's life to try to decrease the likelihood of experiencing a negative outcome. So protective factors related to healthy prenatal development would be quality health care before pregnancy, which would include quality and consistent prenatal care, making sure that the expecting mother is getting good nutrition and has healthy habits like exercise, and then giving support for everyday stresses, related to mental health challenges, because again, those stress chemicals can directly impact the developing baby. And encouraging supportive relationships because they're really protective in terms of mental health, and also ensuring that there's healthy housing and safe physical environments, and that there's a workplace that supports women and men to be parents as well as workers. So again, these are all can be targets for prevention to encourage healthy prenatal development. So you may be wondering, what about the father? Can there be risk factors in terms of the father as well? And there is research that suggests that exposure to environmental toxins can damage sperm. So that can lead to higher rates of miscarriage and infertility, or can damage chromosomes, which would lead to genetic defects. So people who would have higher rates of exposure to environmental toxins, possibly due to where they live or due to their occupation, may they may affect their fertility or may affect their offspring. So it's happened, for example, with fathers in the military, where there has been some research that suggested for some fathers, this is for U.S. fathers who had some exposure in the military to certain chemical agents, that there may be some connection in terms of genetic defects with their offspring. So there can be a link there in terms of a risk factor for prenatal development that comes from the father. And then there's been there's some growing body of research in this area, father's age, because it's known that mother's age presents a risk in terms of the likelihood, for example, of Down syndrome for a baby is much elevated after a certain age. But for fathers as well, there's now some evidence that suggests that there may be an association, a correlation in terms of fathers being older and having their children having certain outcomes, like serious mental illness and autism. There was a research study in Israel that found this link between father's age and serious mental illness like schizophrenia. It's sort of an emerging body of research. That's been an observational study looking at a birth cohort in Israel, so a group of children who are born at a certain amount of time, and seeing what happened with those children and father's age. So it's not entirely known, but it's very likely that there also can be risk that's presented by fathers as well. And speaking of the father or the mother's partner, could be a lesbian relationship, there are sometimes the fathers or the partners can feel left out of a pregnancy because there's so many changes that are going on for the mother to be. But it's also a huge change in the life of the other parent. And so there can be, it's important for expecting fathers or partners to be able to support the mom and the fetus during the period of pregnancy, because they want to be important and help the mother and the developing baby. So there's important roles, because of the importance of social context, for the other parent to nurture the mother, to reduce the stress that she's experiencing and help out in terms of things like cooking and shopping so that she can eat well, take care of herself. The other parent can help the mother remember and get to doctor's appointments, and that can be a shared experience, as we'll talk about in a minute, that can encourage bonding with the developing baby. And then staying connected to family and friends because of the importance of other relationships as creating social connection and buffering stress. And the other parent can also make the connection to their baby through talking to the fetus, feeling the fetus move, and seeing how the fetus responds to the parent's voice, and also learning pregnancy-safe massage techniques. So there's a lot of things that the other parent can do to try to support the mom and the fetus to encourage positive outcomes. So part of giving birth in this point in time, in this chronosystem, in this historical moment, is that people often get to experience seeing their babies before the baby is born by having an ultrasound, and often more than once during a pregnancy. And there's some interesting research that's coming out and that suggests that observing fetal behavior can be a way to start to build that connection, as we'll talk about. It's really part of pre-attachment before the baby is even born. And the observing fetal behavior can encourage parents to make that connection for the baby to feel real, which sometimes it doesn't during the pregnancy, and to spark conversations about hopes and fears and feelings of stress about the baby and about being parents, which can again have a protective function in terms of mental health. And we'll talk more about mental health in the tutorial. So the prenatal environment is the physical environment of the womb, and the perinatal environment is the environment around or surrounding the time of birth. So the perinatal environment includes things like the mother having drugs in terms of reducing the pain related to childbirth, which, for example, having an epidural anesthesia administered via an epidural, which can reduce the sensations of pain quite a lot, or not having any drugs and choosing what's called a natural birth, a drug-free birth, or delivery practices. So babies may be born vaginally, or they may be born via C-section. C-sections are becoming increasingly common, cesarean sections. And there's a lot of concern around the medicalization of birth related to cesareans. And then there's the social environment also of giving birth. And there's been a lot of efforts, I'll talk more about this in a minute, to try to change the environment around birth. And some people are having experiences like home births or birthing in birthing centers rather than having a birth in a hospital, because they want to have a different type of social environment around the birth. So there's evidence that the period right after birth can be a sensitive period for emotional bonding. It's not to say that if that time isn't spent together that it's going to stop there being an attachment relationship. That's not the case because of resiliency, again, that humans can adapt. But there's evidence that during that time right after birth, there's a window where the hormones, there's kind of a priming of both the mother and the baby to start to build that emotional connection. So the baby comes out, and the baby can right away actually can often nurse and latch on, and then the mother also is sort of primed in terms of the experience of birth and all of the chemicals that are released in the body to have the bonding experience with the baby. And so a lot of hospitals, if people give birth in a hospital, have tried to change things so that they're, in the past, where the baby might have been whisked away and put in a nursery, today often there's a lot of effort to keep the mother and the baby together for a period after birth, and also to keep the baby with the mother as much as possible, which is called rooming in, where they keep the baby in the room with the mother, not putting it in a nursery. There can be, and then also it's important to also involve fathers. So fathers are very often, or fathers are the partner of the mother, are very often involved in the birth and need the opportunity also to start forming that important emotional connection. And so fathers and partners may be involved in doing things like cutting the umbilical cord, giving the first bath, and just having skin-to-skin contact. So there's a lot of encouragement now and recognition that that's very comforting for a newborn to have skin-to-skin contact with the mother and with the other parent. So postpartum depression, though, can inhibit the experience of emotional bonding. We'll talk more about postpartum depression during the tutorial, but this is a condition basically where because there are so many hormones that are associated with pregnancy and birth, it can kind of throw people off kilter in terms of their mental health. It's quite a very common experience to have at least some degree of postpartum mental health types of issues, baby blues, but then for some women it's more persistent and it can be more serious. So again, we'll talk more about that in tutorial. I'll end on this note before we continue on with prenatal development in the next lecture. So this is a cartoon with the father, after the moment of birth, saying hello to his new child, and the child saying, "Oh, the terrible singer." So this just points to this idea that babies are primed for their environment, and they're beginning to have a social experience even when they're in the womb. They're hearing already the voice of the parent, and they come out ready for connection with whoever that parent is, regardless of their singing abilities. So we'll continue this discussion of prenatal development in lecture 2.